Hi, I'm Angel Moses, and cancer runs in my family. It wasn't until my second diagnosis of breast cancer that when I learned I carry a BRCA2 gene mutation that put me at a very high risk for both breast and ovarian cancer. But what my family and I didn't know and wasn't told was that this mutation can also affect men. When my dad was diagnosed with an aggressive prostate cancer, I asked both his primary care physician and oncologist about genetic testing. They both told me that the BRCA mutation doesn't affect men. It was only through Forrest that I learned about a link between a BRCA2 gene mutation and a very aggressive prostate cancer. My dad was tested and he carries the same mutation I have. I inherited my mutation from him. We also learned that there are new drugs being studied for aggressive prostate cancer in men with BRCA mutations. People and families with hereditary cancers face many challenging decisions. We need help knowing our options and communicating with our doctors so that we can receive the best care. Thank you, Forrest, for applying for a Cell Gene Innovation Impact Award to create such guidelines. Your Project Decode will save lives and help countless families like mine. Thank you.
Hi, I'm Heidi Trott, and I'm an advanced nurse practitioner who specialises in breast and women's health. I see patients with inherited mutations in BRCA1, 2 and other high-risk genes at the Seattle Cancer Care Alliance. I often help patients and their families when they are struggling with decisions about hereditary breast and ovarian cancer treatment, prevention and survivorship. Sometimes patients come with misinformation on their choices, and this can lead them to be dissatisfied with their care if they do not completely understand all of their options. I also know that at other times patients come to me with new information that they may have read about on the internet or seen in the popular press. As a care provider, I welcome this. I know making treatment decisions can be very stressful. By making sure my patients and I share the most reliable and up-to-date information with one another, I know I can help reduce a lot of this stress and uncertainty, which ultimately improves patient outcomes and their satisfaction with their care. I think if more patients knew how important it is to have these conversations and share information with their care providers, more would do it. I have been a long-time supporter and fan of the work that Force does for this community. If they receive this innovation award, I have no doubt that they would help to ease the burden of making stressful decisions for patients and their family.
Hi, my name is Amy Heineman. I'm 42 years old, and I have a mutation called BRCA1, which is associated with increased risk for cancer. I was diagnosed with stage 3 triple-negative breast cancer when my oldest daughter was 10 months old, about 6 years ago. And that was the beginning of a long list of difficult decisions I had to begin making, from whether I should have a preventive double mastectomy, even though only one breast was affected by cancer, to whether it was safe to have a novel procedure at the time called a nipple-sparing mastectomy in light of my increased risk for cancer due to my mutation. There were so many questions, and even the best oncologists that I sought out seemed not to have all the answers because there simply wasn't research-based evidence to inform clinical practice, and there still isn't in many areas. For example, one of the most challenging decisions for me was around fertility. My husband and I had just started our family, and we desperately wanted to have more children, but the type of cancer I was diagnosed with was aggressive, and I wasn't sure if I should wait to start treatment for the egg retrieval process in the event I became infertile as a result of chemotherapy. We decided to move ahead with treatment and risk not being able to have children later. After chemotherapy, radiation, and multiple surgeries, I miraculously became pregnant, and it was terrifying. I didn't know if it was safe to be pregnant at all. My doctors had been urging me to have my ovaries removed as quickly as possible because of my increased risk for ovarian cancer, also associated with the BRCA1 mutation, and so the tough decisions kept coming. After my second daughter was born, I knew I needed to have my ovaries removed right away, essentially, There was more confusion. Should I have a salpingo oophorectomy, which is the removal of my ovaries and fallopian tubes, or should I have a full hysterectomy, which carries its own set of risks? 2 oncologists recommended I have a hysterectomy, although studies on the benefits of that procedure just weren't available at that time, and still. I had seen 3 oncologists who all gave me different opinions, and ultimately I went with the advice of my oncologist from the beginning, who I trusted most. The list goes on. I have my daughters to think of now, and when and how do I tell them they have a 50% chance of having this same mutation? How do I advise them? How do I help educate and advocate to ensure the road is less scary?